Hi everyone, I hope you're doing well. My name is Kwaku, I am a pharmacist. In today's brief video, I want to highlight 5 quick tips about monitoring your blood pressure at home. The first point that I want to highlight is the importance of monitoring your blood pressure at home. Is it even necessary? Well, I believe it is for 2 key reasons. Number 1 is that it helps to avoid unnecessary treatment. You're probably already familiar with the phenomenon called white coat hypertension, where people's blood pressure tends to be elevated only when they are in their doctor's office. That is, anytime their reading is taken at the doctor's office, their reading tends to be higher than if they take it in a normal home setting. So what happens in a lot of the times is that you go to the doctor's office, your blood pressure is elevated, the doctor keeps adding medications or keeps increasing your dose. While maybe in actuality, your blood pressure may not necessarily be that high when it's taken in a home setting, a setting where you are relaxed, where you're comfortable, and you have more accurate and better readings of your blood pressure. So taking your blood pressure readings at home helps to inform the doctor of what actually is going on a day-to-day basis with you. You can always keep a log and share with your doctor next time you're in his office, not just to make sure that your seemingly elevated blood pressure when you go to his office is not necessarily the case. The second reason why monitoring your blood pressure at home is important is that it allows you to see if any changes in your medication or any changes in the dosage of your medication is actually working. Now, a lot of the times people visit their doctor's office maybe once or twice a year, maybe every 6 months or every year. You don't want to wait a whole 6 months to find out that the prescription that the doctor gave you to manage your blood pressure was actually not working. If you are monitoring it at home, you will know right away after maybe 3 or 4 weeks that this medication is not working. You can then place a phone call to your doctor's office and you can make amends rather than to wait for some people a whole year just to realize that that medication that was prescribed was actually not doing what it was supposed to do. The second point that I want to highlight is that if you're going to invest in a blood pressure monitor to check your blood pressure readings at home, you may want to consider getting the one for the arm, the upper arm cuff. This is because the alternate one, which is the one that you put on the wrist, has been shown in several instances not to be as accurate as the upper arm cuff. Matter of fact, the American Heart Association actually recommends the upper arm cuff. I mean, granted, if you have a wrist one and that's all you have, yes, use it. But in an ideal scenario, what you're wanting to get or what you really need to get is the one for the upper arm. I guess the wrist one comes in handy because it's more portable. So maybe if you're going to go on a trip, if you're going to be traveling, you can carry it. You can just dump that one into your bag and that'll come in handy. But your regular everyday day-to-day blood pressure monitor ideally should be the one for the upper arm. And number 3, talking about getting the upper arm cuff, what you also want to make sure is that you're getting the right cuff size. Using the wrong cuff size may lead to errors, sometimes as much as 30 millimeters of mercury different from what it was supposed to be. The typical cuff size is somewhere between 9 to 17 inches. And therefore, if you measure your arm and it's either below or above, don't forget that there are different cuff sizes. You can get an extra large or you can get a small. So you don't necessarily have to go with a standard cuff size. Number 4, if possible, test your machine at your doctor's office. Now, this will ensure 2 things. Number 1, it will help you compare your readings to what your doctor's office readings are, and you can compare and see if your machine is accurate. Number 2, it also gives your doctor an opportunity to observe you to make sure that you've got a technique right and everything, just so that you're not, thinking that you're measuring your blood pressure, but meanwhile, you may not necessarily have been doing it right, and therefore your readings may have been off. So if possible, just on one of the days that you have your doctor's visit, just take it in, he measures, you measure, and then you compare and see if there are any significant difference. And talking about technique, number 5, make sure you are following the recommended steps to get an accurate blood pressure reading. So ideally what you want to do is you want to sit comfortably. You want to sit about 5 minutes comfortably with your feet apart. Do not cross your feet. Avoid anything that can potentially affect your blood pressure. So don't take any decongestants, don't take any tobacco, coffee within 30 minutes of taking your reading, and make sure that your cuffed arm is at the level of your heart. So in some instances, you may need something to prop it up, maybe a pillow or something to prop it up just to bring it to the level of your heart. You're going to get more accurate readings that way. Relax, take a deep breath, take about 2 or 3 readings, about 2 to 3 minutes apart. Have an average, and that average is going to give you approximately what your blood pressure reading is. Best practice is also to take it at different times of the day. So you take it in the morning and you take it in the evening. So you have a fair idea or a big picture of what your readings actually are. And most importantly, take action based on the numbers that you get. I mean, what is the point in just taking the readings and just filing them away and not taking any action? If the readings are not where they're supposed to be, make sure you pick up the phone, call your doctor, have a discussion, talk to your pharmacist, anybody that can direct you along the right path. So 5 quick tips about measuring your blood pressure at home. Hope you found some value in it. If you did, please give this video a thumbs up. Catch you on the next video. Stay blessed.